Good evening, everyone. My name is Kelly Williams, and my associates and I are here today to discuss 3 different types of weight loss surgery. The 3 types of surgery we will be discussing are gastric bypass, lap band, and the sleeve. Dylan will be discussing the gastric bypass, Ellyse will be telling you about the lap band, and Holly will be going over the sleeve with you today. We will also have Desmond going over the support groups and other seminars available to you. A brief background to help you decide if the seminar is for you or not, or if you qualify for the weight loss surgery. A woman must be at least 80 pounds overweight, and a man has to be 100 pounds overweight to qualify. In order to be approved for weight loss surgery, one must have tried several different diet options and attended seminars about the surgeries. The only way to not have to go through all of this is to pay cash. At the end of our seminar, I will tell you about my personal success story. I have a gastric bypass surgery, and also show you a before picture at the end of my success story.
Gastric bypass is surgery that helps you lose weight by literally changing how your stomach and small intestine handle the food you eat. The food you eat will no longer go into certain parts of your stomach and small intestine that break down food. Because of this, your body will not absorb all the calories from the food you eat. Let's talk about the actual procedure. You will be under anesthesia and asleep for the surgery. The surgery consists of 2 steps. And the first step is where they actually make your stomach smaller. The surgeon will divide your stomach into 2 parts by using staples. The first part at the top is called the pouch. It's going to be only about the size of a walnut. And the bottom, lower part of your stomach will no longer be used. The second step is the actual bypass. The surgeon will connect the jejunum, which is a part of the small intestine, to a small hole in the newly formed pouch. The food you eat will now travel from the pouch into this new opening in your small intestine. Because of this, your body will absorb fewer calories. It's important to understand why you will need gastric bypass. In order to have gastric bypass, you must prove that you are unable to lose the weight and keep it off by dieting, changing your behavior, and exercising alone. When you go home from the hospital, you will only be able to eat liquids or pureed foods for at least 2 to 3 weeks. Then you will slowly be able to add in certain soft foods and eventually regular foods. But there are certain things that you should never go back to eating. When you start eating solid foods again, you'll fill up very quickly. Just a few bites of food is all it'll take. This is because your new stomach only holds about a tablespoon of food. Your stomach will gradually get larger over time, but you'll have to be really careful not to stretch it out too much because you'll start gaining weight again. So you need to follow your dietary guidelines very carefully. For the first few months after your operation, you'll be losing weight very quickly. Because of this transformation, you'll experience certain symptoms. You might feel tired, have body aches, feel cold, dry skin, and you might experience mood swings, loss of hair, or thinning of your hair. However, do not be alarmed. These symptoms are normal. As your body gets used to its weight loss and your protein and calorie intake increase, the symptoms should go away. You will have to begin eating completely differently than you did before your surgery. Remember to eat slowly, chewing every bite thoroughly. The opening between your new stomach and intestines is very small, and if you swallow a large piece of food and it gets lodged in this space, that can present some major complications. So take at least 20 to 30 minutes to eat a meal. If you experience vomiting or pain under your breastbone during or after eating, you're eating too much. Eat 6 small meals rather than 3 large ones, and do not snack between meals. The most important thing to remember is just to simply stop eating as soon as you feel full. Just remember that calories still count, and it's important to get all the proper nutrients with as few calories as possible. And gastric bypass is not a temporary operation and requires a lifelong change.
I'm going to be talking about lap band surgery. Before considering lap band surgery, make sure you are a candidate. The lap band is an adjustable gastric band designed to help you to lose excess body weight. This procedure requires the stomach capacity and restricts the amount of food that can be eaten at one time. The lap band does not require stapling, cutting or stapling of the stomach. The procedure is normally performed under general anesthesia and can last between 30 minutes to an hour. The stoma is placed around the top part of the stomach, making a small pouch through a tiny 1 centimeter incision in the abdomen. The pouch is controlled and can be adjustable by a balloon. This is designed so it can be inflated or deflated any time after the operation. As of here. The advantages of the lap band surgery is there's no cutting or stapling of the stomach. It can be adjusted to the patient's need after surgery with no operation to adjust the stoma. You can fully reverse this operation, and it's only a short hospital stay. The cost is between $15,000 to $20,000. The diet guidelines, it is important to remember to not stretch the stomach pouch out. And 1 to 2 weeks after the operation, it consists of a liquid diet. 3 to 4 weeks after the operation consisted of chopped foods. And 5 weeks, you can start eating soft foods. When you're able to handle solid foods, you need to pay close attention to your diet. And there are foods that should be avoided, which include dried fruits, asparagus, pineapple, corn, grapes, nuts and seeds, carbonated beverages, and high-calorie foods and drinks. To obtain the best results, you should follow these 10 important rules, which are: eat only 3 small meals a day, eat slowly and chew thoroughly, stop eating as soon as you feel full, do not drink while you are eating, do not eat between meals, eat only good quality foods, no junk food, avoid fibrous food, drink enough fluids during the day, drink only low-calorie liquids, and exercise at least 30 minutes a day.
I'll be talking about the gastric sleeve surgery. The gastric sleeve surgery is one of the newest forms of bariatric surgery, and this form is mainly for those people who are too obese or too sick to get any of the other kinds of surgery. In this surgery, they cut out about 85% of the stomach and then staple it back together along the edge to where they make it like a tube or a sleeve. And so it goes straight from the esophagus to the small intestine. So it's a lot less room for food to go, so you feel fuller faster. And it's not reversible, so yeah, this is it starting the stomach before and then after. Since the stomach functions normally, there are a lot less restrictions on the food that patients can eat after the surgery. It's just the quantity of food will be a lot smaller, and over time, however, the stomach can be stretched. Some advantages to this sleeve surgery is that no organs have to be rerouted, or there's a minimum of complications and side effects such as anemia, protein deficiency, and osteoporosis, which can be a problem in other weight loss surgeries. Sleeve is the only procedure that is able to remove the hunger hormone, which leads to weight gain. It's a much simpler than some of the surgeries where they have to cut organs and reroute. No foreign objects are placed into their body, and no adjustments have to be required. It keeps your pylorus reserved, and those with a BMI of 60 or greater will find it very safe. And the cost of this surgery can be well over $10,000. However, the insurance companies are starting to cover it since it is so much safer. And most people lose 50 to 80% of their excess body weight over the first 6 months to a year. Studies have shown that this procedure improves diabetes, high blood pressure, high cholesterol, and sleep apnea within the first year to 2 years. After recovery, certain lifestyle changes are necessary to maintain the weight loss. You must exercise regularly, learn behavior modification techniques, and follow specific dietary instructions for eating, such as eating smaller quantities, chewing thoroughly and swallowing only when it's mashed and fully chewed, and not eating and drinking at the same time.
Today I'm here to talk to you about bariatric surgery and the resources, support resources. TOPS is the oldest weight loss organization for weight loss support. It's an acronym for Take Off Pounds Sensibly. It was founded by Esther Manns in Milwaukee, Wisconsin in 1948. Membership costs less than $3 a month. Your first meeting is free though. Ochsner Health Organization also holds monthly seminars locally. They mandate that any patient requesting any bariatric surgery must attend at least one seminar prior to their request. Whywait.com. It gives you a library of seminars locally from New Orleans to Mandeville to Baton Rouge, and it's furnished by the Surgical Specialist of Louisiana. Wait No More is the fastest growing company weight loss program in Louisiana. It has 3 clinics, one in Monroe, one in Shreveport, and one in Baton Rouge. It gives an extensive personalized weight loss maintenance plan catering to your needs. If you need any additional health information, you can go to droz.com. But they have a multitude of message boards and blogs whose contributors are going through the same thing that you will soon be going through, or you are going through right now, and they understand your problems and concerns. So you can look at those at any point.
Okay, hi, my name is Kelly Williams, and today I'm going to share my success story. Many would not believe that I used to weigh 235 pounds. I started gaining weight at the age of 14, which I thought was from puberty. No matter what I did, I could not lose the weight. I tried everything from diet pills, dieting, and exercise, but nothing seemed to work for me. By 2005, I became extremely ill and couldn't even hold down a glass of water without becoming sick. After seeing many doctors, a gastroenterologist by the name of Dr. Walsh of Louisiana Digestive Health decided to do a liver biopsy on me and discovered my liver enzymes were extremely high. This caused me to have what is called fatty liver disease. They still do not know really what caused it or why I could not lose weight, but all I can tell you is they told me I had to get the weight off as quick as possible. The reason being that if I didn't, I would have to have a liver transplant by the age of 30. At the time I was told this, I was only 23 years old. Although I had a medical condition, my insurance would not cover it. The reason it would not cover it was because of an underwriter clause, which many insurances have. So I had to pay for the surgery out of pocket. At the time of my surgery, April 4, 2006, it cost $18,900 for cash pay. I am very thankful and lucky to have fantastic parents that paid for the surgery, so I didn't have to finance it. I am now 28 years old, and as of April 4, 2012, it will be 6 years since I had gastric bypass. The first 6 months after the surgery can be hard because you basically have to follow strict food intake, but it's all worth it in the end. I promise you that much. Many who have the surgery do gain their weight back, but I have successfully kept it off all along. Thank you.